Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Welcome to Fronteras, A Changing America. I'm Robert Palacios. Today on Fronteras, we'll be speaking with Patricia Juárez, UTEP Latino Alcohol and Health Disparities Research Center Training Director, and Reyna Puentes, Training Coordinator, about the facts on alcohol. Hello ladies, welcome.
Hi, thanks.
How are you doing?
Good, thanks for having us.
So could you tell me a little bit about yourself and your position?
Well, I've been working for 5 years at the Latter Center as a training director, and primarily our work focuses on training different kinds of healthcare professionals on evidence-based interventions to decrease the public health impact of alcohol in our communities, as well as other health-related behaviors. But our main focus has been on alcohol.
Are you originally from El Paso?
I'm from Juárez,
Okay.
and I actually live in Juárez and cross back and forth every day for work.
And Reyna, how about yourself?
I am from El Paso. I was at UTEP as an undergraduate student and did my graduate school there as well, which is where I started working at the Latter Center. We also focus not only on providing training to community providers, but we also have graduate students heavily involved in research, wanting to better understand the impact of alcohol within our college, also within our community. So we kind of have a really interesting mix of people working at the Latter Center.
And what'd you get your degree in?
Clinical psychology.
Okay. What is the Latino Alcohol and Health Disparities Research Center?
Yeah, so I mean, we are like a mix, kind of like I just mentioned, of graduate students doing research to understand alcohol use, alcohol trends, what people do to stay safe when it comes to drinking. And then on our end, we kind of focus on providing education and training to people out there who are actually talking with people about alcohol use. So as we know, it's one of the leading, most prevalent uses of substances. And so pretty much anyone knows anyone that drinks. So it's a pretty common conversation.
You guys will be doing a presentation on the New Mexico State campus at Burrell College. What's that involve?
Yeah, so we were invited to kind of share our talks that we do on getting the facts straight about alcohol. There's a lot of misconceptions out there because it is so common. Everybody thinks that everyone does it. And so this talk is really going to focus on having people understand the science behind how alcohol affects the body, and then having a more like non-judgmental way of understanding how you drink personally, and maybe what you could do to stay safer in some situations where you might be experiencing some risks or consequences related to your drinking.
Okay. How many drinks are in a common container? What's the average drink when we're looking at beer, wine, liquor?
Yeah, that's kind of a trick question because you can ask for a beer, and usually they come in like a standard 12-ounce can, but there's tall boys out there, there's the big 40 ounces, there's craft beer these days. And when it comes to mixed drinks, there's drinks that have 1 or 2, even 3, 4, or 5 shots of liquor in them. And so it gets kind of hard to measure it, especially when you know the bartender at the bar and they're maybe having a little bit of a heavy pour.
Yeah.
But overall, there's been some research to kind of estimate the amounts of alcohol. So a standard 12-ounce can of beer will have the same amount of alcohol as 5 ounces of table wine, which will have about the same amount of alcohol as 1.5 ounces of 80 proof liquor. Now again, those numbers can get a little confusing when you talk about types of liquor that have maybe more than 80 proof, or craft beers. Like I said, those sometimes the alcohol content can get pretty high on those, even up to like 10%. So it's interesting to look closely at the kinds of drinks that you drink, and that gives you kind of a better idea of the average.
Now, what counts as a drink? Like you were saying, you might have a mixed drink that has multiple shots in it, or the craft beer. So is that what we have to be cautious of? Is if we're drinking a craft beer, it's higher percentage of alcohol?
Definitely.
So that might equal, you have 3 craft beers and that's actually 5 regular drinks, or how does that work out?
Definitely. So, some people will say, this X beer is super light and it tastes like water. I don't even taste it. So that's why they go for maybe the darker beers, the ones with higher alcohol content. And even like you said, when it comes to mixed drinks, you could say you only had 1 or 2 drinks at the bar, but most drinks have more than one type of liquor in them. For example, really common among people is the drinking of like margaritas or like Long Island iced teas. And a margarita has 2 types of liquor in there. And so that's already 2 standard drinks in just 1 standard serving. Now, if you go to happy hour and they have the Texas-sized margaritas on special, who knows how many shots they're really pouring into that.
You gotta watch out for the Texas-sized drinks.
Everything's bigger in Texas.
We've heard the term holding your liquor. How can that be associated with over-drinking?
Holding your liquor, it's the term kind of means like, being able or feeling able to drink large amounts of alcohol without feeling too impaired. But that actually signals that your body is becoming tolerant to alcohol, which is a sign of increased risk for developing other kinds of problems related to alcohol.
Now, when you're hanging out with people, you could feel like you need to drink and hang with the team. So what can we do to prevent that? Or, what are some things that students or, even friends can do to stay away from that?
Well, it's definitely a personal choice of, deciding to lower your risk of developing other, other alcohol-related problems and exposing yourselves to risks such as doing things that you wouldn't otherwise do. So it's just a matter of making that personal decision to be aware of how much you're drinking, the time is spent, because we also know that our bodies can only process about 1 standard drink in between like an hour and a half, because anything else that you drink during that time is what makes up for your blood alcohol concentration, because again, your liver, your body can only process that 1 per hour and a half. So becoming aware of these things, understanding how your body works and how alcohol affects your body, can help you kind of make wiser decisions, safer decisions about how and when do you drink.
So you mentioned an hour and a half. So if I have a standard beer, not a craft beer, just a regular drink, would that be an hour and a half of that being processed out of my system?
Yes, it's an estimation because other factors have to be accounted for, which is like your weight, your gender, how much food you've had. But it's an estimate that your body, anything that you drink above a standard drink over that period of time is what's going to linger in your bloodstream, and is what's going to cause the effects of alcohol, is what's going to cause the impairment for driving or for making good decisions.
Okay. What are the guidelines to staying low risk?
Yeah, so there's been some research to kind of help people understand what it means to be low risk. Now, of course, the only way to be absolutely free of risk is to not be drinking at all, because even 1 drink can cause some sort of impairment. Even if you may not feel it, there's still something going on inside your body. And so the World Health Organization, the National Institutes of Health, and their National Institute on Alcohol Abuse and Alcoholism have put together some information to help us better understand what is low risk. And so for men and women, there's different guidelines, because as Pati mentioned, alcohol is processed differently thanks to fat content and all these other things that we have to thank biology for. But in general, for women, it's recommended to have no more than 3 standard drinks in any one night. At the same time, have no more than 7 standard drinks in a week. So you can't really be having 3 every day, because you would end up exceeding the 7 per week. Yeah. And for men, it's a little bit higher. For men, it's recommended to have no more than 4 standard drinks in any one occasion, and no more than 14 during the week. And now, again, I'm going to keep reemphasizing that it doesn't mean that you can have 3 or 4 drinks and go out and drive and be okay. What this really means is that what we know from research, that once men and women exceed those levels, have exceed one or more of those limits, that's when they're more likely to be encountering any sort of alcohol-related problem. This doesn't necessarily just mean a DWI. This means, problems either in school or at work, even if it's just feeling a little hungover the next day and not being at your 100% mental. problems with violence, problems with, people who you love, taking risky decisions. People are more inclined to do things, like Pati said, that you might otherwise not be doing if you hadn't had those 1 or 2, 3 or 4 drinks.
Yeah.
And so those are just kind of some guidelines to help keep in mind of what you can do to kind of keep yourselves away from those risks.
So you mentioned the 4 drinks for a male and at a given time. So I jumped online before you guys got here, and I was thinking a decent night out, you're gonna have like 3 beers and a couple of shots. So I put in 5 drinks for a male, and it said that if you're doing that, you're in a 19th percentile, drinking more than either the single day limit or weekly limits, and that puts you at an increased risk.
Yeah. Sounds like you're a little shocked by that.
Yeah. And it's not something, I'm sure, back in my college days that I was probably at a higher risk, but I didn't think that those, what I would consider lower numbers, would have such a high effect.
Yeah, and then again, that's one of the common misconceptions that is faced out there. People think that the normal thing to go out there is drink higher amounts of drinks to get to that level of either feeling buzzed or feeling tipsy, feeling drunk. But what we do know is that because the way it affects the body, that exposure to the body, maybe it's just 1 night a week, maybe it's 2 nights a week, maybe it's 3 or 4. Over the course of time, that's when you begin seeing the effects. You may not have felt them back in the college days, other than maybe just your hangover, but really in the long term, that's when we really start to see the effects happening.
The next thing that you mentioned was about DWI. And so I looked up some numbers. A cost for DWI can range from $5,000 to $24,000 for a first-time offender.
Yeah.
Looking at those numbers, a ride share from El Paso to Las Cruces is about $100. So I think that helps some people realize, do I spend and be responsible, maybe whether you're in town and you're spending $15 on a ride, or whether you're stuck in El Paso and have to get back to Las Cruces, maybe I should think about that before having to pay $5,000 plus for a DWI.
And you bring up a great point there. What you just said is think about that before you get to that point, because we've all been there when you've had a few drinks and you feel fine to drive. But a lot of things come into play. If you're leaving the bar at 2 a.m., you're much more likely to be tired, and that also has an impact in the way that you're driving. And so a lot of the messaging out there is trying to get people motivated to make these decisions before they go out. And so if you drive your car to the bar, you're much more likely to want to drive it home, either because you don't want to leave it there, you're worried about what could happen if you're going to get towed. Whereas if you might have made that decision before going out to take the ride share out, you'd be more inclined to take the ride share back. And so those are the kinds of decisions that sometimes are harder to make once you've had those 2, 3, or 4 drinks, but more likely to make the right decision before you get to that point.
And you can also always have a friend in the group that's the designated driver.
Yeah.
I know sometimes places offer, free entry if you're the designated driver. You don't have to pay the cover, but I think that's also important looking forward, is maybe having that one person designated.
Yeah.
Can you describe binge drinking to me?
Yeah, so this kind of goes really in line with what we were talking about now. Binge drinking is any episode of drinking where you'd have more than those recommendations in a short period of time. And so if we think about maybe occasions where one might go pre-gaming or tailgating, or if you show up to the bar at 10 p.m. and last call is at 2, sometimes people try to get in as many drinks as they can, especially if it's happy hour or if there's a special going on, or if they sell you the whole bucket of beers as opposed to just the one.
Yeah.
You don't want those beers to sit there and get warm, and so people are more inclined to drink more in a short amount of time. And so that goes back to what Pati was saying about how much your body can process in an hour and a half or 2 hours. That all comes into play.
What are some of the steps in making a difference in your drinking habits? How do you get started?
Well, it's definitely, first of all, get informed, get to know the facts, get to know yourself. And again, those guidelines is like if you already know that you're drinking above those, that's a first sign. But then, of course, the most important is what's your experience with it. For example, has anybody complained about your drinking? Has anybody told you anything? Have you had blackouts? Have you had experiences where you got into fights with people, either physical or verbal? Have you gotten a DWI? So it's about kind of what consequences have you experienced directly in relation to alcohol, or when you think about them, which is a lot of what our work involves, is even if you reflect on the possible things that could happen if you continue to drink in a certain way, maybe that could help you make some decisions about decreasing the risk of getting there. So hopefully you don't have to wait for something like that to happen. You can start taking measures to reduce the risk, either whether it's about drinking and driving or whether it's about the other things that could go not so well.
And another common thing that we try to remind people of is that getting help with your drinking or making changes in your drinking doesn't necessarily mean you have to quit. You have to be abstinent. A lot of times people think, oh, if I'm going to talk to someone about my drinking, they're going to want to make me quit. That's not actually very true. That's not realistic, and we know that from research. And so what we're doing now, not just us, but really the whole movement in terms of getting people to be safer about their drinking, is coming from the approach of harm reduction. So if you think about what are the consequences that you find yourself in if it's drinking and driving, or if sometimes you feel hungover and you have class the next day, what changes could you make in your life so that you don't have to experience those particular consequences anymore? It's really not black or white anymore. There's a lot of gray area in the middle, and our talk today, later on, is gonna really focus on having people become aware that drinking problems is not just alcoholism or alcohol dependence. There's a range of problems related to drinking, and that's okay. First of all, to be aware. Second of all, to know that there's options in terms of making a change.
I could say one of the fears might be, you go to your health provider, your doctor, and they ask about drinking, that if you say, my instance, okay, I have 5 drinks on one night, then they're going to think I'm an alcoholic, and it's all downhill from there. So that's kind of what you're speaking about, is it's not identifying, saying this is how much I'm drinking, and then all of a sudden you're an alcoholic.
Right.
But there might be times where you need to back off a little bit, and so identifying the steps to get there is what it seems like it should be.
It's really unfortunate that there's a lot of stigma around alcohol use, excessive alcohol use, and that makes people feel inclined to not talk about it with their health providers. But if it's something that is a concern to you, if you've had any instance where you think, oh, maybe that could have gone a little bit better if I didn't have that last shot before leaving the bar, that enough is a sign for you to maybe consider some of the other options, like managing your use. Sometimes people will choose to alternate an alcoholic beverage with a glass of water. You're still drinking, there's still something in your hand. You could even pull it off and say it's like a vodka water, but doing things for yourself that's going to make you feel better the next day and not have to run into these consequences.
I think it's staying aware of the amount of time. So that provides, you're having a drink, but in between there's time where your body can process it and you're not just continuously adding alcohol to your system. There's several myths with drinking, and maybe you could provide some information on these, and I wrote down several. I can drink and still be in control.
Yeah, so as we were kind of mentioning, people a lot of times will say, oh, 2-3 beers, I'm fine. But there is something going on in your body, whether you're fully aware of it right now or not. It could be, just stumbling or even problems with memory. And those things are what is concerning, because it's not always just black or white, as we said.
How about drinking isn't all that dangerous?
Well, we're going to also talk a little bit about that. So even, a few drinks can already mean some level of impairment for driving, and we know the risks involved around that, not only for yourself, for causing accidents and such, and legal problems. And we know in alcohol misuse is the 3rd leading cause of preventable death in the U.S. And so that's already given us a little bit of an idea that alcohol, it's kind of dangerous, and it is a problem, a health-related problem, a community problem, and it's not that safe. Sometimes,
I think we need to realize that we're not only affecting ourselves, that there's people around us, whether it's family or friends that we're affecting, or if we decide to drink and drive, that it's the whole community.
Yeah. We have we usually have this slide where we tell people we know that alcohol, we know that it either causes the common problems that people experience and then seek out help for that, or makes them worse, which is unemployment, school failure, job performance, disability, child neglect and abuse, crime. One way or another, alcohol, as I said, it's either causing these things or making them worse.
Do you guys point out the financial aspect of not drinking and how much money you save?
A lot of times that's one of the immediate consequences that people will say is, the next day there was a charge on my card that I wasn't even sure it was racking up that much. And even though you might not think of that as like a physical consequence, at the end of the day, if you really sit down and do the math, it could be pretty impactful. And so sometimes that's one of the changes that people like to implement, is giving themselves a limit or only taking cash to the bar so that you can't keep charging. And that also kind of helps make those decisions beforehand.
Are there any apps that you guys recommend? With technology, there's got to be some helpful resources on our phones, right?
There are, and there's more evidence, or there's more people trying to come up with different apps to help you track your drinks and keep track of that. The challenge is that once we have a few of those, we kind of forget to do that, and it ends up sometimes not being as helpful.
Are there benefits and or dangers of having the Bluetooth breathalyzers on hand maybe? Have you guys seen any studies on those?
We haven't, but we do know that it's one of the common techniques implemented by people who are currently on probation for drinking and driving, and that does help also keep people from getting behind the wheel. We do know that sometimes, though, you can have a friend who hasn't been drinking blowing it and then drive, and so again, people try to find workarounds all the time.
Yeah.
A good resource, though, especially for college students, is the website for the National Institute of Alcoholism and Alcohol Abuse. There's a section particularly directed for college students that has all this information and ways of checking, your own level of risk.
Okay. Let's go back to the time that it takes to sober up, because one of the myths is I can sober up quickly if I have to.
Yes.
So on average, what was that time?
So once alcohol is in your body, 80 to 90% of it is absorbed in the stomach or in the small intestine. So there's nothing that can slow that down. I mean, food can do that a little bit, but once it's there, it's, no matter how much coffee you drink, no matter, how much cold showers you take or how much extra food you eat, you're just going to be full, very awake, and cold because of the shower, but still you're going to be drunk.
So Red Bull, chugging a Red Bull, that don't help.
You're just going to be over caffeinated, but still, that's not going to affect your blood alcohol concentration at all. Once it's in there, it's in there. Except, we need time to pass. So that's another thing to consider. Sometimes people end up drinking around 2 a.m. They go to sleep and they wake up at 7. They want to go to class and they're still intoxicated because not enough time has passed for your body to metabolize that or process it, and for you to be able to not be impaired. You're
so
still
it sounds
gonna
like if you've drank too much, you might have to be careful the next day.
Yes.
Okay.
You can still get a DWI the morning after.
And really, if you try putting stuff into your body after a night of drinking, what ends up happening is that you give your body more things to try to digest, metabolize, and get rid of. And so that Red Bull that you're taking, that coffee, or that big Whataburger burger and fries that you're having, it almost kind of slows down the process because you're giving your body this much more stuff to work on.
Including other substances. We talked a little bit about that, those myths that if you do other kinds of substances that would help you stay awake longer and drink more. It's still, again, once alcohol is in there, your body needs to process that, and it only takes an hour and a half.
It doesn't magically disappear just because you eat a big old burger.
Yes, no.
Now, beer doesn't have as much alcohol as other liquors, right?
Yeah, definitely not. Again, we can go back to that standard drinks measurement and consider that although a beer might take you longer to drink than a shot, you still have the same amounts of alcohol in there.
An average 1.5 ounces for a shot is about a 12-ounce beer.
About a 12 ounce of your regular beer. Now again, if we're talking craft beers, and we know a lot of people here love craft beer, it gets a little bit more unclear.
Before we wrap up, what health problems can arise from excessive alcohol use?
Well, the most common one that we know of is that it affects the liver, because the liver is what processes the alcohol. So it's the first one that starts feeling the effects. But we know alcohol is associated with about 72 health conditions. So again, it's similar. So either alcohol causes them or makes them to be worse. So heart disease, certain types of cancers. What else can you think of?
Any heart conditions?
Yes, heart conditions. Yeah, you're gonna edit that.
And being a part of the Latino Alcohol and Health Disparities Research Center, do you guys have specifics as to how it affects our Latino community?
Yeah, we do know that Latinos, particularly Latino men, are more likely to binge drink. And so we sometimes also attribute that to the culture. You know, there's drinks at baptisms, there's drinks at your kid's birthday party, and sometimes,
weddings.
That makes us think it's okay because it's a part of the culture. But on the other side of that, we do know that Latinos are one of the underserved populations when it comes to resources, health insurance, you know, being able to go comfortably talk to your doctor, whether you're facing, you know, concerns about immigration or whatever that may be. So while there is a high prevalence of drinking among Latinos, there's also this underserved where we don't have access to a lot of those other resources, which makes our problems a little bit harder.
Before we go, what's the best resource to get some more information about alcohol and the effects?
It would be the National Institutes of Alcoholism and Alcohol Abuse, which is by the National Institutes of Health. So if you go look that up, it's going to give you links to a lot of resources. There's one booklet that you can get online, which is Rethinking Drinking. So that's a good, quick resource to kind of get an idea where you stand and, you know, to explore your options a little bit and get resources.
And where can viewers find your organization?
You can look us up on www.utep.edu/LAHDR, and you can get more information on the trainings that we provide and the research that our students are doing. Any questions you guys have, feel free to shoot them our way.
Thank you, ladies, for joining me. Thank you for watching Fronteras, A Changing America. I'm Robert Palacios. Until next time, hasta luego.